Hi, my name is Maria Elizabeth Atiga from base 083-1. I'm here to present to all of you of how to do the first aid if someone had accident or an injury. The purpose of this video presentation is to have a little knowledge of doing the first aid in someone who need. So that it is important to understand since first aid is an essential knowledge that not many carries everywhere. The first video presentation that I will show you is how to treating sprain. What is sprain? Ang sprain ay isang injury involving the ligaments ng isang tissue na nagko-connect sa dalawang buto na maaaring na-twisted ito kaya nagko-cause ito ng pamamaga. Kapag nagkaroon ng sprain ng isang pasyente, ang unang mong gagawin ay bigyan siya ng komportabling pag-upo o di kaya komportabling pagpapahinga. Then, protect the injured part of the patient para hindi na madagdagan ang pinsalang dulot ng pamamaga o pananakit. Next, lagyan ng cold compress ang bahaging na-injured para maibsan ang pamamaga o pananakit. Next is compression. Lagyan ng bandage ang bahaging na-injured at kasamang ibalot ang cold compress na iyong inilagay. Sunod na gagawin ay support. Suportahan kung hindi talaga maigalaw ng pasyente ang bahaging na sprain ay maaaring nilagyan ito ng suporta katulad na lamang ng karton, kahoy o anumang bagay na makakapag-immobilize sa injured na bahagi. Treating fractures. Our second presentation is to how to treat fractures. But in this topic, there are two types of fractures. First, closed fractures and open fractures. Closed fractures if the bone break but it does not surface the skin. Kaibahan naman nito ay sa open fractures. Ang open fractures is bone break pero lumalabas ito or nakikita sa ating skin na nagko-cause ng sugat. If someone who has fractured, first you must do is speak the person or the patient to make them understand that he is not allowed to move. Next is support or hold the joint that is surrounded to the suspected fractured area. Like this. Because immobilize is important situation para hindi na madagdagan ang injury ng isang pasyente. Next is put the splint or straight or any hard object that support the arm of the patient. Next, sunod is gamit ang malinis na tela ay maaari mo itong balutin both side or to support the injured area. Pagkatapos talian or lagyan ng malinis na tila ang magkabalang bahagi ay maaari mo itong talian papunta sa kanyang liig para to support or to immobilize the fractured area. Like this. Pero kung sa leg naman ang injured area, ay maaari mo itong lagyan ng suporta at talian na magkabilang bahagi para suportahan ang injured part or to immobilize the injured part. At laging tatandaan, iwasang masagi ang suspected fractured area para hindi na ito madagdagan pa ang pamamaga at pananakit. Talian lamang ang bahaging kung saan hindi apektado sa fractured area. At mahalaga rin na hindi mo muna pagalawin ng iyong pasyente or ang biktima para hindi na madagdagan ang kanyang fractured area. Ito yung mga signs na makikita kung may fractured ang isang pasyente. Una, deformity. Some changes from the usual look of certain body parts. Halimbawa, pwede mo siyang ikumpara sa isang, halimbawa sa braso, pwede mo siyang ikumpara kung magkaparehas pa rin ba ang kanilang look. Swelling or bruising, kung saan ang suspected area na na-fractured. Extremely pain, kung saan hindi na halos maigalaw ng pasyente ang bahaging na-injured. Wound or bone fractured, kung saan nakikita sa skin. Yan ay tinatawag na open fracture. So the next video presentation that I will show you is to how to treating burns. Treating burns are easy and can be tricky sometimes. So these are some steps of how to treat burns. If someone has burn, the first step you may do is to cool burn area with cold water. Because cold water is the best immediate treatment for minor burns, as it helps to reducing the temperature of the skin and also assists in cleaning the affected area. Do not use ice because it may further damage the injured skin. Avoid touching the wound with the bare hands or unsterile object, and avoid applying gel, butter, or any oil as it increases the chance of infection. Third, do not break blister that may develop. If the blister breaks, clean the area by running tap water over it. Then apply antibiotic or burn ointment. Step 4 of treating burn. Leave the burn alone for 24 hours. Do not cover the burn unless clothing rubs on it. If it's rubs, cover it with gauze pad, tap away from the burn. Remove the dressing every day and clean the wound. But if the irritation and pain does not subside, do not hesitate to seek for medical help. Our next video presentation is how to treat cuts and scrapes. Cuts and scrapes are part of childhood, but in most cases, they're not serious and can be treated at home. If the wound is bleeding, press sterilized gauze or a clean cloth firmly on it until the bleeding stops. Next, hold the area under cold, gentle running water, and also you can use bottled water or slime wound spray. Then, remove any debris by rubbing gently with a clean cloth or use clean tweezer. Then, don't apply any disinfecting solution to the wound because they don't help and it will only cause pain. Change the dresser every day until the wound is okay. Hypothermia is the body temperature which is below what is required for normal metabolism and bodily function. Our normal body temperature is between 97.7 to 99.5 degree Fahrenheit, which is the same as 36.5 to 37.5 degrees Celsius. Hypothermia can be mild, moderate, and severe. Mild hypothermia symptoms are shivering and you may feel cold, and that's normal. If someone has mild hypothermia, the first step you may do is you wanna get the person out of cold. You may use blanket to cover her full body to get them warm. And apply warm pack for the head, armpit, and their neck to help them and raise their temperature and get them feeling better quicker. If someone has severe hypothermia, they can have lost muscle control, they can have confusion, or they can have blurred speech, and they cannot act normal. so that you can had help right away. Call 911 or take the patient into the hospital immediately. Habang naghihintay ng emergency service o habang nagbabiyahe patungo sa pinakamalapit na ospital, ay maaaring balutin ang pasyente ng isang blanket at painumin ito ng mainit na inumin to help warm them up inside and out. Allergic reaction. Ang allergic reaction ay maaaring minor o maging severe pag hindi maagapan na tinatawag na anaphylactic shock na sa kahit ilang minuto ay maaaring makaapekto sa katawan ng tao. If ang isang tao or isang pasyente ay nagkaroon ng minor allergic reaction, ay tanging medisina na resetang ng doktor lamang ang paunang lunas dito. Kaya habang nagsisimula pa lamang mag-react ang allergy, ay pumunta na agad sa malapit na pagamutan para mabigyan ng tamang gamot. Ngunit kung ikaw ay may dala o alam na gamot, maaari na din na inumin ito para hindi na maging malala pang iyong allergy. Pero kung ang isang tao ay nagkaroon ng severe allergic reaction, na karaniwang sintomas nito ay matinding pamumula sa balat o rashes, pagsusuka, hindi makahinga ng maayos at pagtatae. Ito ay dulot sa allergy sa pagkain gaya ng mani at seafood. Maaari ding dahil sa weather and environment. So that if someone has severe allergy reaction, you may call 911 or emergency service and tell that the patient is have a severe allergic reaction. At sunod na gagawin ay huwag mong iwanan ang mag-isa ang pasyente hanggat di dumadating ang emergency service o medical expert. But if the patient had them vitamins for their allergic reaction, help them to take the vitamins para mabawasan ang kanyang nararamdamang sakit. And then, help the patient to have a comfortable position and make sure that the place has proper ventilation. Ngunit, pag ang pasyente or biktima ay namumutla, nanlalamig at halos nagkukulay asul ang labi, then prepare yourself to treat a shock or CPR until the emergency service arrive. Pahigain ang pasyente or biktima at itaas ang mga paa nito. Kung hindi huminga ang pasyente, simulan na ang CPR. CPR or cardiopulmonary resuscitation is used if someone had collapsed and does not breathing. Because CPR, it can keeps people alive until the emergency service arrive. First, shake them gently from the shoulder and ask them, "Are you alright? Are you alright?" If there is no response, you need to shout for help as any assistant will be helpful, and then gently tilt the head back like this to open up the airway. Then look for a normal chest movement, listen for normal breathing, and try to feel them breathe into your face. Do this for more than 10 seconds. If there is no sign of breathing, then start the CPR. Start by placing by one hand at the center of patient chest and interlock your finger like this. With arms straightened, press down hard and fast, letting the chest come back. You're fast around 2 times every second and count 30 seconds. And if you have been trained, you can be give 2 rescue breaths after every 30 compression because this help provide oxygen to the patient. And then, just keep going until the emergency expert arrive or the person is definitely breathing normal. So once again, my name is Maria Elizabeth Atiga from Base 083-1. And thank you for watching my video presentation of how to perform first aid in someone who need, and sana makapulot ng konting aral. Once again, thank you.